All right, so let's kick this off. Welcome everybody to today's session of the Nordic webinars, module number 3. Today we will cover the new DonJoy post-op knee brace, the ROM, and I'm pleased that we have our senior global product manager with us today, Mike Dorwing from California. And just before I give the word to him, just some housekeeping. So I'm going to place you all on mute, and feel free to ask questions, but write them in the chat, and we'll cover them at the end at the Q&A session. And this session is being recorded for you to be able to review it later, but also to share it with your colleagues that can't make it today. So with that said, I'll give the word to Mike, and I'm going to put you, let's see, spotlight on you. There we go. And I'll just stop presenting. And I think we're good to go. All right, Mike.
All right, great. Can you see my slides?
Yep.
Perfect. Good. Well, yeah, I really appreciate the opportunity to get to speak with you all about the ROM brace. So I'll start off with a brief introduction of myself. So my name is Mike Doring. I work for DJO at the Bracing and Supports headquarters based in Carlsbad, which is just outside of San Diego, California. So it's 6 in the morning here, but I'm still excited. I got my coffee and I'm ready to go. Been with DJO for about 2 years now, and I do manage all of our knee bracing products. So includes post-op, which we'll talk about today in our new post-op brace, OA bracing, ligament bracing, and everything else knee I manage. So among my other responsibilities, you can see I've got 3 beautiful young daughters, currently all being schooled at home. So I'll try not to wake them up this morning so we can have an efficient meeting. So I am excited. So as I mentioned, I started about 2 years ago, and the first project that I started on with DJO was the ROM post-op brace. And we really wanted to come out with something that was going to be, we thought, just the best brace on the market and really help address all the needs that you guys have out there for you and your patients. So we'll go through some of the key features, benefits, some of the design rationale, why we did things on the design team. Try and mix it up a little bit. I have a couple of videos, animations I want to show you guys as well, so you're not just looking at me and slides the whole time. We'll do a quick summary, and then, as mentioned, we'll do some Q&A. So look forward to any questions you might have. So as you can see, we've got a lot that we packed into this brace that's really, I think you guys are going to be excited about. But it really fits into 3 buckets that we look at. So fast, easy application. Getting it on your patients quickly is going to be really important. And in some settings, these can be put on post-operatively for the first time. You might not always get a chance to do fitting before surgery. So especially in those settings post-operatively, you want to get it on quickly and get that patient out of the OR. There's a lot of nice features for that. Comfort and stability, very important, of course. You want to make sure the brace isn't going to migrate. So we'll go through some of those features. And you want your patients to be comfortable. Patients can be wearing these for many, many weeks, essentially all day, as you know. So we want to have a lot of comfort for patients as well. And then, of course, we need that ROM protection. That's why the brace is there. So let me quickly unshare here, and I'll try and get a video animation going. And we will give this a try. Okay, hopefully everybody saw that. Let me get my slides back up here. Actually, let's we'll switch to video here. So you guys, I'll try and do some real-time demos to cover what we talked about. So that was kind of a quick overview. So I want to take the next few minutes. I have an ROM brace in my hands here, so I'll try and get it oriented correctly in the camera so you guys can see some of these features as we walk through them. So the first thing, so when we talk about fast, easy application, the tabs. I think you saw that new design that on the back of the brace, we're going to have these tabs that are going to help to close up that amount, the amount of strap that you have between the legs quickly. So you can lay the brace underneath the patient. Let me see if I can get this highlighted here. So you have these tabs on the back, so they just easily lift up. You can adjust the brace, and then it just goes back down and it grips back on. So some of the other braces out there, it takes a little bit more manipulation to try and get the strap length between the uprights adjusted. So that makes it really quick and easy. We also have a new buckle design. So it's designed to go on very easily, quickly again. So let me get it in front of the camera here. I think you saw it in the animation as well. So you can see the buckle, it just slides right over. Oh, let me go a little bit higher there. So it goes right over. It's easy for the patients to put on, take off quickly and easily, which is important as well. So new designs there for us, which I think you guys are really going to like. Another thing, there's a lot of different ways to adjust what we call sliders or the pads. A lot of different mechanisms out there. What we like to use, and we've leveraged from our previous braces as well, is we call a push button design. So you've got these buttons here. You depress with your finger, and it easily slides. And you can see it goes to discrete positions. Might be a little tough in this lighting, but there are etched into the uprights here. There's numbers as well, so you can make sure that you're going to match up on either side of the brace. You want to make sure that, obviously, that you've got your settings the same on either side. So you have that symmetry there for your patient. So you have those discrete settings, easy push button adjustment. Some other braces out there, there's different lever lock mechanisms, things like that. The nice thing about this is it's very strong. So you push that button, and once it's in, you can pull as hard as you want, and that's not going to move, which is very important for stability for patients. It gives it a very strong design. Some of the we call lever lock mechanisms, where there's a little mechanism that flips up and down. we call that a friction lock. And if you take some of those braces and you pull on the upright, you'll feel it'll slide, it'll move. So some of your larger patients, that could be an issue. So really nice stability, which was something that was important to the design team. So looking as well, and we've got a wide range of patients that this can cover. I'm 6'5", so I looked that up. That's 196 centimeters, so I'm a pretty tall guy, and I've worn this many days, and it fits me very comfortably, and it's not even at the longest setting. So we really wanted to make sure it covered larger patients, then all the way down to smaller patients as well. We've had a lot of young people, of course, have these types of injuries that need this brace we've tested on as well. So a very wide range of patients. So you've only got the one part number that makes it very simple for you guys out there to get it on your patients. We talk about fast, easy application. So having it come out of the bag and ready to go is important as well. So you'll see when it comes out of the bag, the straps are all out wide. So you'll open it up, you can lay it underneath the patient. As we talked about, with the gray tabs, you just move all those down. It'll allow you to quickly kind of cinch up the strap length between the uprights, and then you're ready to go. So it makes it very quick and easy to get it out of the bag and onto your patients. Something that is really key that we leverage in this brace from our prior technology as well is what we call our telefit technology. So that essentially means that you've got on each side you've got your 4 pads, and each one of them moves independently. So you move the lower slider down, and there's another button where you can move the pads that are closest to the knee as well. So what's nice about that is one, it's going to help you really customize the fit for all your patients. So again, different sizes, different anatomies, you can adjust. Really try and get the calf cuff right at the top of the calf. You can, which is really nice for improved stability. Having all 4 of them move is also really good. Clinically, these patients just had a procedure done. You might need to move around the incision. So being able to accommodate the incision. Quad tendon is becoming more and more popular. So being able to move on both sides of the knee and adjust the pads out of the way is really going to be nice to have that customization. So not all post-op braces have that, but that's something that's really important. We've gotten a lot of really good feedback from the field on that one. So really nice feature there as well. Probably the first thing you'll notice, so I hope everyone gets get one of these in their hands really soon. Probably one of the first things you'll notice is that it's very lightweight. So we, looking at the design, we really wanted to optimize strength and weight. So you'll see, there's spots where you don't need material. We've tried to take it away to reduce the weight, because reduced weight, it's going to help prevent migration, right? So gravity is the enemy of all braces. So the lighter we can make it, the more stable and comfortable it's going to be. So the X-ROM is really light, 29 ounces. So lighter than a lot of the other offerings out there. Well, at the same time being very strong and having those materials, those high quality, high strength materials in all the right places, but removing it where we don't need it. So that's an important feature I think you guys will really like, and you'll really appreciate once you get one in your hands and you compare it to some of the other braces out there. One thing to note as well, that this brace, it is you can bend the uprights. So I don't think you'll have to as much as some other braces out there. It does conform to the leg very well and to the anatomy. But there's some patients, especially on the lateral side of the thigh, you might need to do some additional contouring to really get the brace to hug close and to feel more natural and comfortable for the patient. So you can bend the uprights. They're designed to be able to be bent. So you would just lay it on the table, and I'll show you a video in just a second of how you could do that contouring. So similar to some of our previous braces, but again, really nice design, allowing you to really fit to your patients and have that custom type of fit. one nice feature that we added here, I'll try and do a close-up of it, is on the ankle, we added this pad. You can see it's folded over on the end here, which makes it a little bit thicker on the bottom. So what that really does is it gives comfort. You know, even if you're going to extend this all the way down to the ankle to really get that good anchor point on the bottom for improved stability. When you extend that all the way down, this pad's design will kind of rest on top of the malleoli and really give you that, you know, comfortable but secure fit. So so we have these, you know, extra thick pads, you know, folded over at the bottom, which is really nice to help, again, improve stability and keep your patients comfortable. Also, you know, really nice feature. So with all of our pads, we've added antimicrobial coating to them. So again, your patients are going to be wearing this for, you know, for many weeks, for, you know, almost all day. So having that in there, it helps reduce the amount of time they're going to have to wash it. It's going to help improve a lot of things like that. So nice feature as well, you know, having that antimicrobial material. For the hinge design itself, so a couple things to note. So one, you know, when you're looking at the quick lock, so that's the one thing to look for when you're thinking quick locks. Everything red essentially is for the quick lock. So you've got your button that locks it into place. You've got a line, see if you can see it here, that goes over, and then you can see the angles. And then on the bar itself, there's a red triangle that indicates the angle. So everything red is for quick lock. There's also, it's probably a little tough to see here, but there's a little window right next to that button where you can see, a little tough in this light, but you'll see when you get it in your hands, there's a little window right next to it that when it is locked, you can actually see there's a little red piece of plastic comes into that window. So you can just glance at a brace and it just helps you identify if the brace has been locked into position or not. So we've also added a few more options there. So we go from -10, 0, 10, 20, 30, just to give you flexibility depending upon your protocols. You can lock it in any of those positions. When it comes to adjusting range of motion, so, you know, very simple, just, you know, pulling out the gray stops, sliding into place, and letting go, and it does have kind of a spring mechanism that pulls it back in. So very stable, you know, easy to move. While at the same time, you know, it's designed so that patients wouldn't, you know, inadvertently bump it and change the range of motion. So it really has to be something you're trying to do to pull out and move. So that's kind of the basics of the hinge. So easy to use design as well. So I think with that, you know, I'll go back to my slides very briefly here. And then we'll open it up to questions. But I kind of use this as the key takeaway and the summary. So, you know, setting a new standard in post-op ROM bracing through fast, easy application, which we talked about, comfortable stability, and precise ROM protection. So those are, again, kind of those three buckets we think about: fast, easy application, comfortable stability, precise ROM protection. So yeah, I think with that, I know that was a lot of information quickly. Let me share with you guys. I'm going to open up the application video to how to apply. So give me just a second here. So this video is a few minutes long, but it'll kind of give you, again, an overview of the brace and how to get it on patients. So I'll start that now. Okay. So that I think that's the end of the presentation portion. I'm not sure if we've had any questions come in yet, or if there's anything else we'd like to chat about.
So no questions yet in the chat, but I'll give the people a few minutes to write them in the chat. All right, so first question. Is the X-ROM rigid enough for severe malalignments and heavy patients?
Yeah, so that's a good question. So when we talked about, we really wanted to optimize lightweight design along with strength. So as part of that, we did a lot of testing on a lot of different size patients. So I mentioned I'm a pretty tall guy, but we actually had someone who's my height, but about twice my weight that was part of the of our study. So he was 400 pounds US, so that's about maybe 180 kilograms. So pretty large person. In our initial pilot testing, we've had even larger people that we've put it on. So I think it's the design, the materials. Then we talked a little bit about the push button design. Having the sliders instead of being on a lever lock. Sometimes we got feedback that some braces that have that the lever design, that some of those heavier patients can put a lot of strain on the sliders and the pads and make them move around potentially. So having that push button design and having that added strength I think has really been proven beneficial for some of those larger patients.
Perfect, thanks. Let's see if we have any other questions in the chat. So to all the participants, just feel free to write them down in the chat, and we'll cover them.
I do get asked a lot, and we had it in our video, but we get asked a lot, can you contour this brace? There's a lot of braces out there that just because of the design and there's a lot of rigid plastic on them that they can't really be contoured, or the way the metal's designed, they can't really be contoured or bent for those real custom fits. So with the X-ROM brace, you absolutely can contour. So I don't think it'll be as necessary as with some of our other braces. It tends to conform to the leg a little bit better. But again, you have those options. You can flare out the lateral side of the thigh. You can on the calf. You can if you really want to get that hinge close to the knee. There's a lot of people that will kind of do a double bend on the knee, so they'll bend it, and then below the calf they'll bend it back in to get back to the ankle. So you do have those capabilities. If you're familiar with our exact ROM braces, and that's how you prefer to fit currently. I think you can still do those bends. We've tested, obviously with a lot of our current customers to get that feedback. But again, I think just because of the design of the brace, you probably won't have to do as much contouring, just because it is really, again, designed to conform to the anatomy.
Yeah, and I really think it's kind of the best of both worlds here. You have a thin, lightweight material, which contours fine just by pulling the straps, but also the strength of it. And I think that balance is just a key success factor with this brace, right? So another question here about the accessories for this brace. What's available?
Yeah, so we very shortly. So right now, the brace is obviously available, but we are in the very near future here, and probably in the next week or so, we'll be releasing a couple of accessory kits. So there will be a replacement strap kit. So we hear a lot that sometimes people will trim the straps too short, and then what do? You have to get a whole new brace. Or we'll have that strap kit out in the next couple weeks for you guys. So we will have that. There's also going to be a replacement pad kit. So we haven't had anybody really need that yet, but it's a nice option to have. Again, sometimes patients, if they wear it for for their first procedure, maybe they have a procedure on the other leg or another procedure a year or two down the road. It's nice to be able to get them a fresh set of pads if needed. So those will both be available in the next couple weeks here.
Great, thank you, Mike. Let's see. Right. So another question here. All right, no, that was more of a comment. You have done a really good job with this brace. The customers think it's easy to fit and lightweight. Really awesome, easy to sell. So yeah, I guess you get a lot of that in your home market as well, right? It's a quite easy sell for the reps, right?
Yeah, it's as a marketing and engineer guy, it's pretty rare that you launch a product and people are pretty much universally happy. But I think there's that's definitely been the case with XROM, and it was a lot of effort, and we knew that this was a key product and a key launch for us. The Exact ROM's a great brace, T-ROM's a great brace, but they hadn't been, we hadn't had a new brace in some time, so we knew we had to really look at all the features, look at all the needs of the market, and do a lot of testing. I mean, we did a lot of internal testing. Of course, using all of our equipment. We all wore the braces. The whole design team. We wore all the competitive braces. We wore our braces. We wore prototype braces. We did extensive field testing. So it was over a year ago when we put the first versions of these out in the field for some initial field testing. Got some feedback and made some small adjustments and fine tunings. We really wanted to come to market with really a really strong offering that we thought would be the best brace on the market. So a lot of effort went into it. I think a lot of us are excited to see our baby out there now and seeing people really enjoy the brace.
Oh, that's great to hear. So a question here from a customer who just needs some kind of additional guiding when to choose the Exact ROM and when to go for the X-ROM.
Yeah, I mean, good question. There's not a lot of cases where I would say that you'd need to go with the Exact ROM. One thing I have heard from some markets, so the Exact ROM does have, so on the hinge design, it has those hinge locks, so you can put that in place to prevent the patient from moving the ROM adjustments. The XROM doesn't have that. We designed it so that if you are going to move it, it's going to be intentional. So the Exact ROM does have those locks in there. Again, if the patient really wanted to, I guess they could remove them. But if you have a big compliance concern or something like that, maybe you could go with an Exact ROM brace, and we'll have that offering for you as well. But I mean, overall, the XROM, it's got, it's going to be easier to use. It's going to be lighter weight. It actually accommodates a wider range of patients. So it actually goes longer and shorter than the Exact ROM. So there's not a lot of instances where you would need to use the old one. Of course, if it's your preference, if you've been using it for a long time, I'm happy to continue supplying that one for you. But the X-ROM, we've seen a lot of customers, both competitive customers as well as some of our current customers that are using ExactROM, T-ROM, start switching over because of of all the new benefits that we've talked about.
Great. Yeah, and I think you're touching the right points. We definitely have a lot of customers who are using our current range, either the T-ROM or the ExactROM, and I guess they're just kind of preparing their arguments for doing the switch.
Yep.
Good stuff. So I think we're pretty good here. I really want to thank you, Mike, for a great presentation, a great session. This has been recorded, so we'll be sending out a link to all the participants for you to review the video later, or share it with your colleagues. So that will come in an email, a follow-up email. So again, Mike, thank you for a great presentation. Thank you for a great product. We're really excited to be launching that here in the Nordics, and yeah, I'm pretty sure that we're gonna see some good cases here. So thanks again, and have a good day.
Great, thanks everybody.